Hello, Calaveras County. The doctor is in, and I'm your host, Mike Taylor. That doctor is Dr. Randy Smart. Dr. Smart, how are you?
I'm doing great, Mike. Thanks for having me on the show today.
You bet. Now, this time we're going to talk about something that has been all over the news for the past several months, and I think it's something that we really need to talk about, and that's, well, what was supposed to be a healthy alternative to sparking up a cigarette, and that's vaping.
Vaping, Mike. Yep.
Vaping.
You got it.
Every bit or more dangerous than lighting up that cigarette.
Well, I was thinking you would ask me that at the end of this show, but we don't know.
Okay.
It's a really controversial question. Is it better to smoke tobacco or is it better to vape?
Mm-hmm.
I don't want to start the show this way, but
okay.
That's like asking me, is it better to shoot yourself with a 38 or a 45?
Yeah.
And they're both really bad.
Yeah, they're both really bad for you. And that's
Right.
kind of where I thought the doctor would go
Right.
in that question. Let's back up to the kind of very beginning of this. When did, and I don't even really remember because I don't smoke, but when did vaping become this kind of quasi-alternative to cigarettes?
It really started longer ago than you might think. It was around 2003, 2004. And if you go into some of the tobacco research labs, even prior to that.
Oh.
But it really became public around 03, 04.
Mm-hmm.
And the problem, well, there's lots of problems, but it has really escalated to the point where we think of it now as an epidemic problem.
Mm-hmm.
Because so many people are using it and maybe not being aware of the risks or aware of the impact it has on your health.
Yeah.
But it's been around a while, and I haven't seen the actual data, but I would imagine if you looked at it, it's just escalated.
Oh, sure.
And maybe not even linearly, maybe just
kind of shot
boom.
up in
Yeah.
just the past 3 years.
Boom.
There are myriad questions that I can ask with this, and I'm not sure exactly where to start. Do we start with what is it that's actually vaped? I mean, what's happening? You know, when you light a cigarette, there's a fire, you're burning the leaf right there in the rolled paper. What's going on in the vaping delivery method?
So full disclosure, I've never vaped.
Mm-hmm.
Have you?
Nope.
I never vaped, so I can tell you what I think I know about this without personal experience. But you're exactly right. Is there a difference between smoking and vaping?
Mm-hmm.
And they may seem visually the same because there's what appears to be smoke being inhaled and blown out, and isn't that all the same? Well, they're very different because smoking cigarettes, you're pretty much lighting something on fire. You're combusting materials. You're creating probably 100, 200 different types of toxic products that you inhale.
Okay.
Vaping is not combusting anything. Mm-hmm. It's taking a substance and vaporizing it.
Okay.
So you take a substance, and an example would be nicotine, and another example would be THC, and you're mixing it with something that vaporizes, and we can talk about what those substances are, and then you are heating them up, usually with a battery operated device. You're heating them up, they get really hot, they vaporize, it looks like smoke, and you inhale that vapor.
Yeah.
So there are two really very different things that kind of look the same.
That look the same, and maybe you don't know this answer, but I'm going to ask it because it seems like the question that would have been asked first is, did we initially think that vaporizing to get the nicotine was going to be safer than igniting those 200 compounds that you inhale all those toxins with the smoke?
That was the thought. These were, and I think they're still called e-cigarettes, but many people now are calling them vapes. And, but they were originally e-cigarettes, and the thought was conventional tobacco cigarettes are addictive, they're harmful, and maybe these e-cigarettes would be a way to come off of nicotine. Well, it turns
Okay.
out that there is, well, it turns out a couple things. One is I'm not sure it helps anybody quit.
Yeah.
Not convinced of that. But there is, in many of these products, there is much more nicotine in the vaped product than there is in the cigarette. Yeah.
Okay.
And in some cases, they've reported as much nicotine in one vape as there is in an entire pack of cigarettes.
Oh my gosh.
And nicotine overdose is a little bit of an issue. But it was originally designed to help people stop or at least decrease smoking.
Reduce
And
their amount of smoking.
I'm not convinced it does any of that.
Yeah. Like I say, this is such a tricky one because I feel like every question has the just don't do it kind of answer, especially coming from a medical doctor.
Well, actually, that's not the way I would address this.
Okay.
Because there are things you really shouldn't do, and there are other things you probably shouldn't do, but are better than that.
Those, yeah.
So it's not like an all or nothing kind of thing.
So maybe what are here's what you really shouldn't do kinds of things, and maybe that leads us into talking about what's in the vape beside the vape liquid, aside from the nicotine that they're putting in ridiculous dosages, it sounds like.
So maybe in the other order, Mike. So what happens is that vaporized material can create a lung reaction that is a bad reaction.
Oh, okay.
And it's based on inhaling sort of oil-based products into the lung.
Okay.
Because oil is a substance that vaporizes pretty well when you heat it. And so these oil-based products cause bad lung reactions, and because of that, you get really sick.
Yeah.
And that really creates a problem, which can include death.
Sure.
And so I think to date, the CDC has recorded something like 2,400, 2,500 reported cases of vaping acute lung injury, and they've recorded 50 to 60 deaths as a result of that.
And I guess what is that lung disease that's reported? Are the lungs full of nicotine oil, or
Well,
what kind of happens to them?
Kind of. So back when I was in training, which was in the 1980s, we had something called lipoid pneumonia. Pneumonia means there's something really wrong with your lungs, not necessarily infection. And lipoid pneumonia was people that had accidentally or occasionally intentionally had inhaled oil-based products and hydrocarbons. And so this vaping lung injury looks very much like lipoid pneumonia.
Oh.
And oil and lungs do not get along.
Don't go together.
Yeah, they do not get along. And so you'll take these substances, and again, THC is a good one to talk about today, and you'll mix it with an oil so it vaporizes. Well, when you get that oil into your lungs, then there is a reaction that looks like pneumonia and becomes serious, hospitalized, and really, really sick up into including death.
Yeah. And is this something that happens in a matter of hours, days? I mean, is this something like you have an attack and you can't breathe and that's it?
Not really.
Okay.
Not that kind of dynamic. It's more like you develop a cough, and then you kind of feel short of breath, and then you may have some intestinal symptoms. You may feel nauseous. You could even throw up. You may have some diarrhea. And then you just start to feel bad. I mean, just bad. And that doesn't occur during the vaping event. It doesn't really occur the same day. But over the course of a couple days, maybe even a week or two, you develop these symptoms. They become worse. And somebody's, you end up in a care facility, whether it be an emergency room or a doctor's office, and they say, man, you're really sick. You know, you're not getting enough oxygen. We need an ambulance. You need to be in the hospital.
I would imagine the effects would wind up being kind of cumulative, aren't they? I mean, because when you consider most smokers aren't just going to vape once a day, they're going to do it several times a day as if they're smoking a cigarette. You know,
would guess.
smoking cigarettes several times a day.
I would guess.
So
it probably is cumulative.
yeah.
But I would imagine in some patients, those can be relatively low doses and still pretty harmful. It's kind of like tobacco. There are some people that smoke tobacco for years and years, and it doesn't seem to do too much damage.
Yeah.
I hate to even say that because I don't think anybody should smoke tobacco.
Smoke, yeah.
But there's others that, man, they've got emphysema, they can't breathe, and so people react to toxins differently. You know, it's the, I don't know how many of us there are, 250 million.
Yeah.
And in this county, 45,000. We're all different.
Yeah.
I mean, we all have a stomach, or at least most of us. And, you know, we have organs and we have arms and legs, most of us. But we're all really different, the way we react to things, our immune system. So I would think it would be cumulative, but I don't think there is a dose relationship. It's a really good question. It's an excellent question that I don't know the answer to, but I don't know that you could say the more you vape, the more likely you are to end up in the hospital.
Sick.
Yeah, I'm not sure that's the case.
Okay. Has the Centers for Disease Control and any other doctors running across this, have they come across any sort of other things that are kind of a connective tissue, like those who vape especially frequently or are vaping particular products in, you know, are people who are vaping THC getting sicker or more apt to get sick than those vaping nicotine? Kind of where are those lines?
Right, so there are something like over 400 different vaping products.
Oh, gosh.
A lot. Most of those come out of China. About 95% come out of China. Of those, there are probably a significant number of those contain THC.
Okay.
And I think it's something like 150 odd products contain THC. So what the epidemiologists and the pulmonologists have done is have said exactly what you just asked. Which products are doing this, and are they all the same, or are they more toxic or different? And there's some real common denominators here. The THC seems to be a common denominator. That those that are vaping THC tend to have this lung injury.
Okay.
But in particular, the substance they're mixing it with is a vitamin E oil.
Oh, I have heard about that.
That is called vitamin E acetate.
Okay.
I think that's correct. And so THC is being mixed with vitamin E acetate. And the way we know that is some of it you can get from the patient's history. But not all patients are forthcoming, and particularly as you get into 17, 18 years old, maybe less so. So these patients, these teenagers, and we should talk about age groups, these teenagers that are admitted with this, we can do procedures where we wash out their lungs.
Oh.
It's called bronchoalveolar lavage. And we can do, while they're on breathing machines and maybe in a not very, maybe kind of a coma kind of thing, we can wash out their lungs, and we can take the stuff we wash out of their lungs and send it to a lab and say, what's in it?
Oh, okay.
And there is a very, very strong correlation with THC and vitamin E acetate. Now, what's interesting is if you eat vitamin E, not in large quantities, but if you take vitamin E as a supplement or something, that's okay.
Yeah.
Your system likes that. It's useful. It's a vitamin, not in large quantities. But if you inhale vitamin E, bad news, man.
Bad news.
Yeah.
And we can both apologize to viewers for kind of bouncing around, but you mentioned the age groups, and I had kind of waited for that because I was thinking, okay, we're trying to prevent smoking. Let's try vaping. Adults get into it, and where I was going to go is the e-cigarette, and E stood for electronic at the time.
Right.
The electronic cigarette manufacturers got what I will call marketing smart and decided to make the nicotine taste like bubble gum or birthday cake or chocolate ice cream or mint or
chocolate, bubble gum. You're exactly right. They intentionally targeted our younger part of our community with flavors.
Yeah.
And that was very effective. I'm surprised it was effective, but it was. And those flavors, and they targeted our younger patients, younger citizens. And so that was intentional. I think it's almost criminal, to be honest with you, but they targeted them, and it was really effective. Get this, 39% of our teenagers have or are vaping.
My gosh.
39%.
Have we ever had that percentage smoking cigarettes?
My
gosh.
I don't know.
It sounds like a huge percentage, when you consider teenagers.
It's a big number, Mike.
Yeah, it really is.
And that's not a Calaveras number. I don't know the Calaveras numbers.
Yeah.
That's more of a national number. Probably a state number. In fact, the state may even be higher, California, right? But man, that's a big number.
That's a really big number. Now, is there something that is different that's happening in these younger, perhaps not quite completely developed lungs that's making them sicker? Because you mentioned that these young people seem to be getting sick with the THC products that are vaped, especially more frequently than others. Is something going on there? Do we know?
We are going to bounce around today.
Yeah.
Our biggest concern with younger people is actually the effects of nicotine.
Nicotine, period.
And the nicotine or one of the most important times of brain development is as a teenager. That's when your brain is really making some important developments. And nicotine affects that.
Okay.
It affects brain development. It affects emotion. It has a very strong effect on a hormone called adrenaline. You probably know, all right?
Sure.
And there's another one called dopamine. But nicotine has a profound effect on those. Now, those are neurotransmitters. Those are neurohormones. And we really get concerned about nicotine in teenage brains. THC is of concern, too, for a lot of other reasons. But the whole idea of a teenager smoking either THC or smoking nicotine is a real problem, and that's exactly who is doing all of this.
Yeah, and do they necessarily get addicted quicker because it's flavored like birthday cake?
Good question.
No.
I don't know if they get addicted quicker, but I do know that if they get addicted to nicotine, they are more likely to get addicted to something else. There's something about brain chemistry. So if you're addicted to nicotine, you're more likely to become addicted to other chemicals.
And that's because your brain gets used to that Pavlovian, I got some of that, now I want more.
It's a reward thing. Exactly. Right. It's a reward. So your brain says, I like this. This addiction thing is fun, and I like it and it makes me feel good.
Yeah.
Why don't I try something else addictive?
Yeah.
And we don't really understand that really well, but it is a real problem in that age group.
And so let's kind of move a little bit to watch out if you are vaping. I'm going to say heaven forbid, but if you are vaping, you're going to start feeling crummy. You're going to have that cough. Is this like a feeling of I'm getting pneumonia
Yes.
because it's so close to the lipoid?
Yeah, absolutely.
Yeah.
So if you were to do the work the doctors do, what we would tell you is somebody comes in with that cough, they have headache, they don't feel well. Man, that could be a lot of things.
Yeah, sure.
And what we would say is, well, we're certainly going to take a vaping history and ask a lot of other questions, and vaping may be an element of the history, but it could easily be influenza. It could be another bacterial or viral pneumonia, another viral pneumonia. So that toxic reaction tends to look similar to those.
Okay.
And so you can't just say, well, you were vaping, therefore you've got
that.
you've got the vaping pneumonia. You can't say that. You have to say maybe influenza, maybe they aspirated, maybe it's another toxin. I mean, there's lots of things we breathe in that are not so good. So you really have to take a broader approach, because in some diseases, you can tell exactly what it is from the history.
Yeah.
An example would be a migraine headache.
Oh.
When we hear the history of migraine headaches, we can say that's a migraine headache. And there's many diseases like that. With this particular disease, there isn't that kind of history. You have to,
There's a little bit of mystery time, it sounds like, where you're doing lots of tests to figure out
there is
exactly what's going on. So if we find out, do we have a name for vaping disease? Have they? It sounds like we kind of do, but
I believe it's called EVALI. E-vaping acute lung injury. I'm not sure what the E stands for. EVALI. Avali, maybe? Avali? I haven't.
Unless it's electronic again, but
electronic, but maybe it's electronic,
vaping,
sure.
Yeah.
But there is a name for it, and right now we're in the epidemiologic phases. But I think one of the things I really wanted to get out today is to make sure people understand that this is a bad behavior. It's a self-destructive behavior, and we, as a community, need to get that message out. And we as parents need to be aware, and we as 17 and 18-year-olds need to find something else to do. Yeah, exactly.
Okay, I'm going to ask the question you should never ask a doctor, which is, I think, the question I asked at the beginning. But is it a case of put away that e-cigarette and go back to the smoking of the regular cigarette?
You did ask me that.
And work on, getting onto the gum and working on your nicotine cravings and quitting smoking that way?
Tough question. So let's take this approach to it.
Okay.
Not smoking anything is where you want to be.
That's perfect.
That's where you want to be.
Sorry, I should have started there, doctor.
But that's okay. And so it's not a perfect world. I have patients that smoke a half a pack a day, and that's better than the 2 packs they were smoking.
Yeah.
And I congratulate them for that. What I would say is if you believe you can quit by smoking e-cigarettes, then I support that.
Okay.
If that's your intention and you believe you can do it, then I support that. However, you should be very careful about where you get your vapes.
Yeah.
You probably should not get them online. You should probably not get them from a friend.
Yeah.
And you should probably not get them from any source other than a reliable, commercial, non-online source.
Okay.
That's what I would tell you. Because most of these vaping lung injuries have had that history. Well, a friend gave it to me, or I was at a really cool party and everybody was doing it.
Yeah.
And most of these younger patients that are getting into this trouble have that history.
Do they get, we didn't quite cover this, do they get sick and almost always get worse? Or is this treatable, and can we bring their lungs back to 95%?
So great question. Surprisingly, a number of these are treated as outpatients.
Oh, wow. Okay.
So they have the history, they have the vaping. We've determined it's not influenza, and we pretty much decide this is the EVALI disease, but they are not in enough trouble to hospitalize.
Okay.
So we're very careful with these patients. We see them as a return appointment, a couple times a week. We kind of monitor their oxygen levels. We give them a whole list of things to panic about.
Oh, okay.
If you can't breathe, if you develop a temperature, on and on. Those are things where you need to get to the hospital. But they can be managed as outpatients, and they are managed as outpatients. I don't know the exact number, Mike, but it's something like 20-30% of these can be managed out of a clinic.
Oh, okay.
It has to be by somebody who understands the disease and knows what they're doing.
Yeah.
And I would say that really should be a pulmonologist.
Do you happen to know if we've had any cases of this here in the county?
Statistically, we should have had.
Should, yeah.
Yeah, they should be here. I haven't seen any, but it's an age group I normally don't see in my clinic. I kind of see the older age group. It's kind of what I do. I am certain there have been cases. I don't know if they've been reported.
Yeah, okay. Is that something that doctors are considering and the CDC are considering reportable? Is that that's something that when you see this, we have to report it?
It is reportable.
Oh, okay.
Yeah, it is reportable. And the CDC has been very gracious about testing. If you do these lung washout procedures or you sometimes have tissue from biopsies they're more than willing to figure that out. I'm certain we've had cases, but I don't know the magnitude, Mike.
Yeah. Okay.
And I know I'm pretty well connected with the hospital, and I haven't heard too much about the ICU.
Yeah.
Or, to be honest with you, I think our kids are maybe better behaved than many communities. I'm kind of proud of our teenagers. I think they're good teenagers.
Well, and we're in our last minute, so let's kind of boil this message down like we usually do. We've always told people don't smoke. But
or smoke less.
Yeah, smoke less.
Don't smoke or smoke less.
Yeah, and if you're vaping, be very, very careful and pay attention if symptoms start to appear.
Yeah, really pay attention and think about what you're doing.
Think about what you're doing, ladies and gentlemen. There you have it. And so for now, the doctor is out. Dr. Randy Smart, thank you very much. Until next time, folks, be healthy.